So what do you mean by screening programs? These are techniques or tests by which we find the signs of cancer before the patient comes with any symptoms to our clinic or OPD. So in this, the commonly used is a mammogram. So mammogram is something like an X-ray of the breast. It can be either a film mammogram or it can be something like a digital mammogram, where the computer will digitalize the picture of the X-ray of the breast and tell us if it is abnormal or normal. So this is a routine screening program that is done in India as per the health guidelines that we have, the national guidelines that we have. It is recommended for all women above 45 years of age to do an annual mammogram. There are certain other countries which also start the screening program by 40 years of age. Especially if you have a significant family history, the screening starts quite early. Basically, mammogram has exposure of radiation also. So in young patients, like if you have a significant family history and we start screening the patients at least 10 years before the onset of the first individual in the family who has breast cancer, the screening program starts way early as 20 years of age. So between 20 to 30 years of age, to avoid risk of radiation exposure, which can also lead to other cancers, we use this MRI. And MRI is much more sensitive in detecting certain tumors compared to the mammogram. So again, the institution should have expertise for doing such investigations also. So you might have heard about this genetic syndromes of BRCA1 and BRCA2. So cancer families that run these genes are those candidates where we test the MRI of the breast every year, alternately with mammogram, or in the carriers in the family, we test them at early age starting from 20 years with a yearly MRI of the breast. So the next modality that we have is the ultrasound. Ultrasound is a very commonly used screening method whenever a patient complains of a vague lump. That is the first screening method that is done before it is referred to a center for a mammogram or a MRI. And the most common lesions that are picked up with ultrasound are cysts or fibroadenomas. So anything more than that, we have to complement with a X-ray or a mammogram. There are certain other newer techniques of screenings that have come called the digital subtraction tomogram, which is a series of X-rays of the breast which are again computed in a computer, and a three-dimensional image of the breast is created. This is not an accepted screening method in our country. However, in certain Western countries, they have authorized even DBT as a screening program of the breast. And there are certain queries where people ask about this non-touch technique called Thermogram, which are usually done as screening measures in certain corporate offices. So this actually picks up the temperature of the skin, and it so means that any tumor generates some heat, and this heat is transferred to the skin, and that is picked by the thermogram, and then they screen and they tell whether this is an abnormal heat which requires further testing. However, this is not a recommended screening program as of now. Okay, by saying this, I conclude my few words. Any queries, you can reach us to us readily at Sri Shankara Cancer Hospital. Thank you.